Taking a break from cooking, May is National Stroke Awareness Month, and here to talk a little bit about more about that is Dr. Thomas Mattio from the Neuroscience Group. Good morning.
Good morning. Smells wonderful here.
Well, we'll feed you. That's the benefit of being a guest on this show. There's lots of good food after we work. But first, let's talk a little bit about what is a stroke, and are there different types of strokes?
A stroke is a damage to the brain from changes in blood flow, and there are different types. There's a variety of types. They're really categorized into two major types of strokes: a hemorrhagic, which is a rupture of a blood vessel in or around the brain, and then the ischemic, which is where a blood vessel closes off in the brain, causing damage to the tissue and the neurologic symptoms for stroke.
It seems like they're a very sudden thing. They come on, fast. Is there anything that you can do to help prevent a stroke?
Well, healthy lifestyle is a good way to prevent the stroke. Stroke prevention is a big thing now, since stroke is such a common disease, and it's really just the same types of things people are aware of for heart disease: managing your cholesterol, watching your high blood pressure, diabetes, atrial fibrillation, which is an irregular heartbeat, lifestyle changes, no smoking, watch your alcohol intake, and regular exercise, and monitoring your cholesterol.
Are there some warning signs that you need to, be aware of if you feel like something, like this might be happening to you?
There are some more common warning signs than others. A stroke can affect any part of the brain, causing any kind of change in your body, but the typical warning signs is loss of vision in one eye or the other, double vision, slurred speech, loss of the ability to speak, weakness or numbness on one side of the body or the other, sudden severe onset of a headache. Those are the most common types of things we see.
How important is it, if you have some of those things going on, to get in there quick?
Well, it's extremely important because there are a variety of different treatment options for stroke. The problem with the treatment options is they are very time sensitive. We have up to about 3 hours to try to reverse a stroke by one method, and up to maybe 6-7 hours depending on the method that we're using. But after that, these damage is pretty well fixed, and there's really no acute treatments available after that time period.
But if they catch it in that time period, it sounds like that you guys can do a lot.
If caught in that time period, there's a variety of options to try to reverse or prevent the stroke from actually happening, yes.
What are some of the things that your group does?
Well, I'm with the Neuroscience Group of Northeast Wisconsin in Neenah. It's a multi-specialty group. We have neurosurgery, we have pain management, and then we have a whole core of neurologists that cover all types of neurologic disease, from stroke to epilepsy to headache.
When a patient comes to you and they're in that beginning, you catch it early, tell me about a success story where you guys have done all you can, and do they pretty much get back to normal?
Oh, we've had people get completely back to normal, and people that may not be back to normal but certainly have a very functional, normal life afterwards, yes.
And for more about your group and what you do, and if you have any of the things that we talked about, it's so important, as you said, to catch it early. It makes all the difference in the world.
Catch it early. We try to stress to people to call 911. Most people, we hear the story many times of people, they feel the symptoms and they wait till their child comes home or their spouse comes home. It's really important to call 911 and get to the closest emergency room for acute treatment for stroke, absolutely.
All right, thank you so much. Always good when I have these months to just, take a look at it and start talking about it. So
it's an important disease.
It really is. And for more on the Neuroscience Group, you can go to www.neurosciencegroup.com. Thanks, Doctor.
Thank you.
Appreciate it.